Hello dear viewers, this is our special program from Obian Horn of Africa. With this program, we're going to hold discussion on regional health matters, specifically on Eastern and Central Africa. To do so, I do have guests here with me from Kenya, from IGAD, from ECSA, Eastern, Central, and Southern African Health Community. So my guests will make introduction, and we start our discussion. Stay tuned with us. Before starting our discussion, let's make introduction. Would you all introduce yourself?
Okay, thank you. My name's WAKO Gofu. I'm a medical epidemiologist working with the IGAD secretariat, that is the Intergovernmental Authority on Development. Thank you, and good
Thank
to have
you.
you.
Let's move to Dr. Matu.
My name is Dr. Matu. I work for East, Central, and Southern Africa Health Community. We call ourselves ECSA Health Community. ECSA is an intergovernmental organization for the region in the Eastern and Southern Africa, and we are a health-only organization.
My name is Dr. Peter Chirotich. I am a Senior Deputy Director of Medical Services in the Ministry of Health in Kenya, and specifically I am the project coordinator for the health emergencies preparedness, response, and resilience program.
I thank all of you, and in the coming few minutes, the representative from Ethiopia, Dr. Feyisa, will join us. We expect him. Till then, we will continue. We'll move on our discussion. As we all know that in these regions, the Eastern and Central Africa, as well as entire Africa in general, the people are very much vulnerable for so much man-made and natural disasters. Health is very much related to those things. Here, health emergency is a critical issue these days. And what does health emergency mean? Let's begin with that.
Generally, as you correctly put, this region, essentially which comprises of the Horn of Africa, the Eastern Africa, and the Southern African countries, are generally characterized with multiple health emergencies. And essentially, the health emergencies constitute, health, emergency conditions that go beyond not only disease conditions, but actually go beyond that. And of course, this includes health emergencies like, disease outbreaks, like what we currently have in the region, like the Mpox, outbreak, the Marburg outbreak, cholera outbreaks in the, in a number of the countries, as well as emergencies like climate-induced health emergencies, like what we call heat, floods, also constitute, kind of a part of this, definition of health emergencies. And of course, in this region, one of the key health emergencies that has always been previously affected this region is the locust invasion. So this is also considered as part of health emergency, as well as drought conditions. So we've had, a long kind of drought over the last number of years, for example, that spanned from 2021, I think, through 2022, which affected a lot of, livelihoods and all that. So essentially, health emergencies is a definition that goes beyond the disease, conditions, and also covers environmental as well as other, climate-induced health conditions. Thank you, and over.
Health emergencies goes beyond outbreaks, because a lot of times you have talked about outbreaks of cholera, Marburg, Ebola, and so on and so forth. But the region has also been faced by other non-disease emergencies. For example, Kenya, I think in the month of May and April, was grappling with floods, and of course these come with so many other aspects, including other diseases, the reproductive health issues, pregnancies in children, and so on and so forth, mental health issues, which I think we also need to deal with after handling the health emergencies. Countries like Mozambique has been faced with multiple cyclones, and of course that comes with destruction of health infrastructure and other general infrastructure, which of course the government has to come and address much later. As my colleague has indicated, drought has also been a major health emergency. And Zambia, for example, in just the recent past, has experienced one of the worst drought situations that than any other issue. So those are some of the health emergencies that we have to grapple with, in addition to pandemics and epidemics that the region, of course, has been exposed to.
So maybe just to add that no country in this region is immune to health emergencies. And so that's why we require collaboration across all the countries of the region. If we look at disease outbreaks, for example, they tend to cross borders, and so working together in tandem and working in collaboration with the regional agencies, IGAD and ECSA, is very useful, so that as a region we have a common and collective approach to dealing with health emergencies.
Okay, thank you, all of you. Maybe proceeding to my second question. Recently, maybe health emergency issue has become very fundamental, especially since the outbreak of COVID-19 pandemic. And now countries have been exerting much effort to ensure their preparedness as much as they can. Recently, what are the major health emergencies or health matters in the form of pandemic, outbreak, or whatever in the region these days?
Yes, thank you for that question. Of course, as we have indicated, there are disease outbreaks, and in the recent past, just right now, DRC, Burundi, Rwanda, Kenya, and of course Zambia also experienced its first case of Mpox. That's one major outbreak or pandemic that is happening in the region that the countries are grappling with. Rwanda is also, as they are dealing with the Mpox, Marburg hit the country, and the country is also responding to the Marburg outbreak. In the recent past, there has been quite a multiple outbreaks of cholera, which of course affected a number of countries, and as well as other situations. So in terms of outbreaks, those are some of the recent disease outbreaks that affected the region. Flooding has been an issue, as we have alluded to earlier, as well as cyclone, which has affected a number of countries in the south, especially in the southern Africa, particularly those countries that are bordering the Indian Ocean. So those are some of the health emergencies that have affected the region in the recent past. And as my colleague has indicated, some of these are cross-border nature, and especially transmissible, transboundary diseases that require collaboration and cooperation among the countries. And that's the reason why institutions like ECSA and IGAD helps to bring or to foster that collaboration so that the countries can be able to work together.
In addition to the issue I've already mentioned, maybe would you mention some of the pushing factors? What are the major factors? The Eastern, the Central African region is highly susceptible to those outbreaks and pandemics, as we mentioned. What are the reasons? Why not in other places?
Yeah, thank you so much. First of all, I think generally you realize that part of the Eastern and the Horn of African countries, and of course including the southern part of the African continent, generally are characterized with a fragile public health system. And then on top of that, especially in the Horn of Africa, and of course part of the Central Africa, you also have a bit of issues around conflicts and all that. That affects generally. We have a huge population of refugee population especially in the Horn of Africa, and so most of these things coupled compound the already existing health system. So and of course on top of that, then we also have other drivers of health emergencies like climate change, which play a significant role in health determinants or disease outbreak determinants or health emergency determinants, like what my colleague mentioned about the flooding, and of course the prolonged drought situation in the Horn of Africa, and of course beyond that, of course really impacts on health conditions, and of course culminates into outbreaks at a number of times. So these are some of the major drivers. And of course, the other issue that maybe I need to mention is the nature of the cross-border. I think we still need to do a lot, I think as Dr. Peter mentioned, on cross-border collaboration. Apparently, it still remains a weak link in the surveillance of disease, generally diseases, infectious diseases for that matter. So this also compounds, the situation as to why we continue to have some of these health emergencies, of course, notably the outbreaks like cholera, like mpox. And just to mention that mpox, you find that from the presentation that was made by the countries today, mpox outbreak has been found to be, majorly clustered along the corridors, the transport corridors. So that's of course an indication that we still have to do more on cross-border collaboration.
In terms of maybe risk factors that fuel the transmission or risks to health emergencies, one of the aspects is we have very porous borders, and that facilitates an ease of movement of diseases across the region. The access to potable water, which is a critical element, and especially when it comes to diarrheal diseases like cholera and so on. And that creates a difficult situation, and especially when you want to control some of these outbreaks. The issues of hygiene and access to toilets and so on, hand washing behavior. During COVID, because there was this messaging and awareness on the importance of hand washing, some of these diseases, especially diarrheal diseases, had the numbers had down. But then after that, because the message is not forthcoming again, we have this coming back. So that kind of behavior in terms of those practices of hand washing and other hygiene practices are very critical in terms of controlling some of these diseases.
And I would like to emphasize a point that Dr. Wako mentioned around transportation. I think this region is one of the most networked in terms of transport, whether it's air transport or ground transport. I think we have flights, I don't know how many daily flights from Addis to Nairobi, and the same from Nairobi to Kinshasa, and from Entebbe to Dar es Salaam. So that, in a way, much as it's good and we want our people to move freely and network and trade, that also is something that has created some additional exposure and risk to travel. And we saw that during COVID, and that's why occasionally when we have such governments may have to think, should we restrict movement? And that's a debate that I think will continue to go on. But I think with the emergence of IGAD and the East African community, there's a lot of free movement of people and goods across the regions, and also that means there's greater contact with people.
Maybe Dr. Martin, ECSA operates in Central, Eastern, and also Southern Africa region, and maybe its coverage scope is really high. So what kind of maybe prevalences do you notice in these regards? Maybe the thing I would like to mention is the African in general health system is very much fragile. It's reportedly mentioned. So in enhancing the health strategy in African countries, maybe it assists us the ways they can respond to emergencies whatever times they happen. So what is ECSA doing, and also how are you assisting the countries in the region?
In terms of assisting and supporting the countries in the region, as part of our mandate, we have a responsibility to partner with the governments and also partner with other institutions to be able to build capacities and enhance the investments that the countries are already doing. So for one of the major aspects spanning from preparedness is we've been working with the countries to profile health emergencies so that you are able to know which health emergencies a country is likely to experience, and you are not shooting in the dark in terms of preparing, because we have limited resources, and it is important that you target the particular challenges that you are likely to face than investing everywhere. So there's the aspect of risk profiling, and then preparing what we call contingency plans, which are prepared for the countries to get ready. And when the countries experience such a health emergency, that contingency plan is converted into a response plan, and they use that to respond to such emergencies. So the other aspect that we've been supporting the countries with, governments and a number of countries have invested in what we call public health emergency operating centers, and some of these require capacity building. So in terms of health workforce development, that is one element that we have been supporting the countries so that they can be able to have strong incidence management systems, of course supported by the capacity that is there in the EOCs. So those are some of the aspects that we have been supporting the countries with. The other aspect is the lab systems improvement, because we know, especially for diseases, the confirmation is done at the laboratory points. And therefore what we've been doing is to support the countries to enhance the detection capability for such diseases, supporting the laboratories with the qualities by improving quality systems, so that you are assured of the results that get out of the laboratories for both clinical purposes, but also for surveillance reasons.
IGAD as a regional organ, we know IGAD is operating in the region and also working a lot on health. How is IGAD's effort expressed on this regard, on all maybe health emergencies, as well as resolving the country's problems in their health system, maybe in correcting or in reorganizing their health policies and strategies?
We had an IGAD delegation that was commissioned by the Executive Secretary, Dr. Werkenegebeyehu, for the Executive Secretary for IGAD, to do a needs assessment and situation analysis in Uganda. And this is in relation to the Mpox outbreak that is currently ongoing in Uganda. So this is actually part of the regional mandate that IGAD has to support the member states, to basically see how they can support countries in the preparedness and response to outbreaks. So one thing that we need to recognize is outbreaks or disease outbreaks have no borders generally. And of course these borders are generally imaginary. So IGAD generally, we try to, as we support member states, and of course going beyond now the member states, like the current project, we try to bring in the holistic approach to supporting the countries in terms of enhancing preparedness and response capabilities of the member or the countries. And of course some of the key initiatives that we are undertaking through the current ongoing project, and of course other projects, of course include addressing One Health, strengthening One Health or multi-sectoral approach to basically respond or prepare to outbreaks. That is one key thing that we are trying to enhance this conversation within the countries, so that we bring together the several multi-sectoral stakeholders in the country to address health emergencies. Secondly, we are trying to also highlight the issue of climate-induced health conditions. So we are trying to profile the major conditions that are caused by the climate change, so that now we can develop response plans, contingency plans to address or mitigate these disease conditions. This is one of the key initiatives that we are currently having conversation on in the region. The third aspect is about local manufacturing. IGAD is pushing the agenda of trying to support countries to develop their capability to manufacture, for example, vaccines as a priority intervention. So, and Kenya and actually Ethiopia is taking lead in this initiative, so that by 2030, we have vaccines that can be deployed as key intervention to address major health conditions like some of those disease outbreaks. The other aspect of course is cross-border. We are, as Dr. Martin said, we are working closely with ECSA to strengthen cross-border coordination and collaboration with a view to enhance countries' capacity in terms of preparedness and of course in terms of also response to major outbreaks. Of course, other priorities include integration of surveillance systems. We are trying to see how can you find that most of disease surveillance systems in the countries are not really working together. There's a bit of in some instances. How can we bring them closely? Surveillance include the human health as well as environmental, kind of monitoring system. So closely and bring this together so that it can disease conditions or outbreaks or health emergencies in a timely manner. So some of the key issues, but of other issues around lab, for example, enhancing lab networking is also another key issue that we are trying to support all the countries. Within the region, of course, in collaboration with other partners, and of course a lot of issues around strengthening capacity for public health emergency operation centers, disease surveillance capabilities, laboratory capabilities, or diagnostic capabilities. So there are so many initiatives that are currently ongoing. But notably, we believe as IGAD Secretariat that we can only exist as one, as a region, because generally diseases have no borders.
Okay, we have been, Dr. Feyisa has already joined us, and I'll be raising a question, maybe from Ethiopian side concerning health emergencies preparedness and response. What are the activities underway?
Thank you very much. I'm Feyisa Regasa from Ethiopian Public Health Institute of the Ministry of Health and working as IHR and One Health office head. So we all know global health security threats are on increasing, and particularly in Africa, about 80% of the health emergency are due to infectious disease, obviously like measles, and nowadays malaria, and cholera, and also the public health emergency of international concern. And at this time, like mpox, and also other emerging diseases like the Marburg. And obviously this is true. And the second very important and the reality is global health security capacities lagging behind, particularly in Africa. In Africa, the global health security capacity is below the global standard as it is measured by joint external evaluation and also state parties and the self-assessment. So in Ethiopia, based on the multi-sectoral and One Health approach, we have conducted this IHR monitoring and evaluation framework assessment, including the simulation exercise and also after-action reviews based on One Health approach. And we have, to address this, we have already developed the National Action Plan for Health Security around the 19 technical areas of the IHR and also 56 indicators of the joint external evaluation. And now we are on the process of implementation of this one. So there are obvious health security capacity changes, particularly since COVID-19, in the capacity to prevent, detect, and also the response. And that obviously includes the surveillance, the laboratory, the multi-sectoral coordination, and the preparedness, and case that also includes the case management and every component of the public health emergency management and the cycles. Actually, when it comes to Ethiopia, particularly in the joint external evaluation and also state party self-assessment and security capacity assessment, it is a bit and above the world and average, and also African average. Particularly, there is the impact of the emerging health securities threats like COVID-19. Though it is a threat, it has helped us to develop capacities across these technical areas.
the health matter or the health issues to some extent related with the economic status of the countries as well as citizens. Maybe health services are not really these days in general in Africa. They are very tough. They are not affordable. Maybe to address those challenges and also to make collaborative effort, what should be done and what is being done? Maybe let me start again this question from Dr. Feyisa, and all of you respond.
We need to invest and on public health emergencies for obvious reason. It has a high impact, and economically and socially. We all know the crisis due to COVID-19 has impacted a lot on economy and also all social components of a human being. So investment in public health intervention has a positive economic return. That's very important. As the second one, as a developing country, and resource mobilization is a very important component, and the donor support is a very important component of the national and regional health security component for obvious reasons. Unless we secure resource, particularly from donors and partners, and as a developing countries, we cannot ensure, we cannot attain the minimum health security capacities.
I do agree that our economies and our socioeconomic status, particularly in Africa, is something to concern us. But I think what we should understand globally is that issues of health emergencies require shared responsibility, because as we saw during COVID pandemic, it may have originated from China, but then it ended up in the United States, and so if a disease originates even from Kenya, which is a low economy, it is upon the global community to support a country like Kenya or Ethiopia or Congo to be able to deal with this epidemic, because eventually it would affect everybody. So that's why one of the biggest additions of this project is, much as we are low middle income countries, we want to build our capacity to produce our own vaccines, so that in case there's any emergency, then we should be able to collectively as countries work together. But that said, and I agree with my colleague from Ethiopia, that yes, we are poor countries all the same, but there are very cost-effective interventions like immunizations, like childhood immunizations, that have a return on investment, very good return on investments. So we should not shy away, as even if we are poor countries, we should not shy away from investing in very highly cost-effective interventions. And lastly, within that economic discussion, we see investments in health security as an insurance to the health sector, and particularly to universal health coverage. Because when we invest in health security preparedness, health emergencies preparedness, we are basically preventing shocks to the health sector. And so I believe that poorer countries should spend more even on health emergencies than richer countries, because the consequences of poorly mismanaged health emergencies are even more devastating to poor countries than to richer countries.
I'd like to stop our discussion here. Of course, if we do have time, we can further discuss on regional health matters. I thank all of you, Dr. Darso, Dr. Martin, Dr. Feyisa, and Dr. Peter, for your time and for your insight. Thank you very much. Dear viewers, you've been watching our special program. That's the end of our program. Stay tuned in the remaining session of OBN Horn of Africa transmission.